A delegation of Republican lawmakers have made a visit to the border to assess the crisis unfolding there, and what they saw was even worse than expected. After travelling to El Paso, Texas on Monday and touring an illegal immigrant processing venue with Border Patrol agents, the group have made an impassioned plea to President Biden. House Minority Leader Kevin McCarthy held a press briefing and revealed some illegals were discovered to be on terrorist watch lists. Dangerous persons are also being released into the US, along with positive cases of the CCP virus. Unaccompanied children's lives have been placed in jeopardy, and sex trafficking has increased. Many are as young as 5 and 6, and they are being exposed to things no child should have to endure. McCarthy said the White House needs to act as the lawmakers attempted to find solutions. This is where he should bring Air Force One. This is where he should look the people in the eye. This is where he should talk to the border agents and let them know that this is beyond a crisis. McCarthy stated he can continue to deny it, but the only way to solve it is to first admit what he has done. And if he will not reverse action, it's going to take congressional action to do it. Republican Representative of Florida, Carlos Jimenez, says many children are being held at the processing centres. They are turning up alone and their lives are constantly in danger. For me, what impressed me the most was the faces of the boys and girls, hundreds of them who are here alone, unaccompanied. Later, when they are released into the country, we don't know who they are going to be with. You cannot check if they really are with relatives or someone who loves them, or someone who really wants them for other things. This is the danger stemming from the Biden policies. According to Breitbart News, Republican Representative of Florida, Maria Salazar, addressed the Hispanic American community in English and Spanish, telling them that President Biden's immigration policies hurt Latinos. We need to join forces and send the message that we cannot allow what's happening on the border because it's our girls, Honduras, Guatemala, Nicaragua, the ones who are being raped. Our girls are the children who are being trafficked. Child sex trafficking is one of the highest international crimes booming in this country. In this country, you have to arrive legally. We must indeed reform the immigration system without a doubt, but we should not enter this country illegally because our daughters and our families are put in danger during the journey. Also, the traffickers, the coyotes, are the ones who are making all the money, she said. From a record high of $61,781.83 on Saturday, a rise of more than 40% since late February, Bitcoin dropped 5.3% to $55,865 on Monday, as investors grappled with an impending sanction from India on cryptocurrencies. The cryptocurrency hit a record high on Saturday after US President Joe Biden authorized his $1.9 trillion fiscal incentive and the hastening of vaccinations. Analysts believe the escalation of Bitcoin has been facilitated by the forecast of a sharp economic upturn and investors' perception of Bitcoin as a windbreak against inflation. India, Asia's third largest economy, is formulating a bill that forbids possession, issuance, mining, trading and transferring crypto assets in line with the government program to prohibit private virtual currencies while structuring its official digital currency. John Wu, president of AVA Labs, a platform for generating financial applications employing blockchain technology, remarked, renewed interest from the Indian government in banning cryptocurrencies led to the initial drop from the $60,000 range down to $56,000. According to industry estimates, India's transaction volumes are rapidly increasing, and 8 million investors now hold 100 billion rupees in crypto investments, despite government warnings of a ban. Despite Monday's setback, investors believe the outlook for Bitcoin's price continues to be positive. According to Seth Melamed, the Tokyo-based COO officer of cryptocurrency exchange Liquid, the legislation India is proposing will not obstruct further gains for Bitcoin. Due to its decentralized nature, any government acceptance or ban is irrelevant as capital will always find a way. This year alone, Bitcoin has risen more than 90%, largely outstripping old-fashioned asset classes, powered by the recognition of cryptocurrencies by major companies and significant investors such as Tesla Inc. and Bank of New York Mellon. Sergey Nazarev, the co-founder of Chainlink, a decentralized network that provides data to smart contracts on blockchain, said, "The reason Bitcoin's continued rise is such a surprise to the traditional financial market is because they are looking at its fundamentals, while they should be looking at the market forces driving its adoption." He added that Bitcoin is involved in the same market dynamic as all fiat money, where market forces determine its value much more than any kind of clear fundamentals. Justin D. Anathan, sales manager at digital asset company Diginex in Hong Kong, said that Bitcoin's record on Saturday was a hit in thin markets due to technical factors and the weekend. Governments and policymakers worldwide have attempted to deal with the COVID-19 pandemic, taking measures such as implementing lockdowns and stay-at-home orders. But it is debatable whether the actions taken have helped combat COVID-19, as the consequences are increased domestic violence, suicide, mental health disorders, drug overdoses, and substance abuse. According to a systematic review and meta-analysis conducted by the non-partisan National Commission on COVID-19 and Criminal Justice, worldwide domestic violence incidents in the US increased by 8.1% following the imposition of stay-at-home orders. The review also stated that lockdowns and pandemic-related economic impacts may have exacerbated factors typically associated with domestic violence, such as increased unemployment, stress associated with childcare and homeschooling, and increased financial insecurity. The 21 leaders of organizations worldwide, such as the World Health Organization and United Nations International Children's Emergency Fund, submitted a joint statement in April 2020, calling for actions to be taken for domestic violence against children, older adults, and women. According to results from a June 2020 Centers for Disease Control and Prevention study, overall, 40.9% of respondents reported at least one adverse mental or behavioral health condition, including symptoms of anxiety disorder or depressive disorder, symptoms of a trauma and stressor-related disorder related to the pandemic, and having started or increased substance use to cope with stress or emotions related to COVID-19. In May 2020, Dr. Mike de Boisblanc, head of the trauma department at John Muir Medical Center in California, stated, "I think originally this shelter-in-place order was put in place to flatten the curve and to make sure hospitals have the resources to take care of COVID patients. However," he said, "we've never seen numbers like this in such a short period of time. I mean, we've seen a year's worth of suicide attempts in the last 4 weeks." Based on the projected deaths of despair from COVID-19, which was conducted by Wellbeing Trust and the Robert Graham Center for Policy Studies in Family Medicine and Primary Care, deaths from suicide, drug abuse, and alcohol abuse increased due to the unemployment, mandated social isolation for months, and possible residual isolation for years. School closures have also negatively affected households, Dr. Robert Redfield, former CDC director, said during a medical webinar in July 2020. There has been another cost that we've seen in particular in high schools. We're seeing sadly far greater suicides now than we are deaths from COVID. He described the consequences of prolonged school closures and stressed that health must encompass individuals' overall social being. According to a preliminary report by the nonpartisan American Institute of Economic Research regarding the cost of lockdowns based on data from research journals, the CDC and other organizations, the US had over 81,000 drug overdose deaths in the 12 months ending in May 2020, the highest number ever recorded in a 12-month period. In late June 2020, a CDC study showed that 13.3% of US adults started or increased substance use to cope with stress or emotions related to COVID-19. While all these profound negative impacts on mental health and the ability to combat addictive and abusive behaviors can be attributed to social isolation and lockdowns, such measures' benefits remain a question.